afternoon, everyone. This is Carla with NeedyMeds. Thanks so much for taking the time to join us this afternoon. And I am the Education and Development Coordinator here at NeedyMeds. This afternoon, I'm going to spend some time teaching you how to find patient assistance resources on the NeedyMeds website. We'll get started with just a few housekeeping tips. If you have questions, please feel free to ask them at any time by typing them into the questions bar of your GoToWebinar control panel. And I will take some time to answer the questions at the end. Keep in mind this webinar will be recorded, and you can find similar ones on our webinar library page under the Getting Started tab on our website. I, of course, will also provide my contact information at the end should you have any other questions or would like a copy of this presentation. So, what is NeedyMeds? So here's an example of the NeedyMeds homepage screenshot. NeedyMeds is a national nonprofit organization founded in 1996. Next year will be our 20th anniversary. And it was founded by a retired physician, Dr. Sagal, who is our current president. Dr. Sagal and a medical social worker that was a colleague discovered patient assistance programs and wanted every patient and every physician to know about them. So he created a website. NeedyMeds is an informational resource. Through our website and our toll-free helpline, we connect patients to programs that provide financial assistance for healthcare expenses, including but certainly not limited to medications. We do not offer financial assistance directly, but rather we refer patients to programs that do. Our website and really everything that we do is free and anonymous to access. We never ask any questions or require registration. We work hard to ensure information is accurate and up to date. And we're proud to say about 1.4 million people use our website each year. We work hard to ensure that the information online is accessible and updated regularly. And you can find financial assistance programs under the Patient Savings tab on our website, which is actually where we'll begin. So what are patient assistance programs, or PAPs? PAPs are prescription assistance programs which are sponsored by pharmaceutical companies. They offer free or deeply discounted prescription drugs to those that qualify. There is no law requiring pharmaceutical companies to do this, so each company runs their programs differently. Keep in mind, not every drug will have a PAP. Eligibility requirements and applications will vary from program to program. Some will help uninsured people. Others will help those with insurance but without drug coverage. Still, others may help people who have drug coverage but cannot afford their copayments. It does vary from program to program. One common requirement, however, is that the patient's healthcare professional usually needs to be involved. And that means you'll have to have a doctor sign the PAP and provide a valid prescription. So here's our current NeedyMeds homepage. And to find prescription assistance programs, you can search for a drug simply in the drug search bar on the top left, or you can go under the Patient Savings tab. The Patient Savings tab is where we'll spend most of this webinar. So it seems that it's actually not coming up right now, so we'll do what I had originally suggested, and we'll type a brand name drug in the drug search bar on the top left-hand side. I'm going to demonstrate by clicking on a brand name drug by the name of Lipitor, because it's a common one. Now this screen that comes up, as you can see, has a whole bunch of different icons on it. What these icons do is they show you what type of information is available for that drug. So for example, this icon indicates that a patient assistance program is available. This one would indicate a coupon. And of course, we have other helpful links, including support pages, which provide you more information about that drug, or copay codes. You'll also notice that there is a to Z index, and that's for simple searches, and you'll find that at the bottom of most of the databases on our website to keep things simple. So again, we're looking for the drug name Lipitor, and you can see it did come up in our search. When I click that hyperlink, you can see that in addition to a patient assistance program, support pages providing more information about the drug is available, and there's also a video about Lipitor. So of course, I'll choose the link to PAP, and this will redirect us directly to a page that lets us know what prescription assistance programs are available for this name brand drug. At the very top of the screen, you can see that there's actually 3 PAPs available for Lipitor. Something to keep in mind, if there is more than one PAP available, as there is with this drug, the PAP that offers the most assistance will be at the top, and the one that offers lesser assistance will be all the way at the bottom. So let's say I just want to show you as an example how easy it is to locate information about this PAP program, which is all right on your screen. Right at the top of the screen, on the first PAP, you can see the name of the company providing the PAP, as well as their contact information. Now, that's very important because you're going to want to keep in mind that if you have any questions or require information about this particular PAP, you're going to want to contact the program directly as opposed to NeedyMeds. Next is the application section, and this is usually where you'll find an interactive link for the application itself. And of course, that can be completed online and printed out. Another important section, of course, is the eligibility requirements section. Now, as I mentioned, although eligibility does vary from PAP to PAP, it is almost always based on insurance coverage and income. And because that's so common, the income requirement, which is usually based on a certain multiple of the federal poverty level, we purposely and conveniently put an FPL, or Federal Poverty Level Calculator, right here. And I'm going to demonstrate to show you how easy this is. You simply click on the calculator, and let's say, for example, we have a family of 2 with a pretty beefy income of $65,000. A quick tip, you'll notice I only typed in digits. Please do not put commas, periods, or dollar signs. Again, this is a family of 2 for a year. And the results indicate that this family's yearly income is 408% of the federal poverty level. Now, returning to the eligibility requirements, you can clearly see that this couple is in fact eligible. They do fall between 400% and 500% of the FPL. But let's say that this family's FPL is 390% or 510%. Let's say this family's income falls just slightly outside of the eligibility requirements. Well, when this happens, don't despair. If your income is slightly over or below the limit, call the program directly and ask them for something called an economic hardship exception. They do that all the time. And if the first representative turns you down, call again and re-represent your case. You may actually find someone with a more sympathetic ear. If you're still denied, appeal. And finally, if the appeal is not successful or the drug does not offer a PAP, call the drug company that makes the product directly and ask them for an economic hardship exception. Again, this is something they do all the time, so it is certainly worth your time. Keep in mind that we do estimate the application process can take about 2 to 4 weeks from the point of submitting the application to receiving the meds. Be sure to keep this time frame in mind so you don't put yourself or your clients in the dangerous position of missing their medications. And finally, at the bottom, you'll see the medication section. And this is important because it will let you know who to send the application to and details for reapplying. Now, a quick tip for healthcare workers that are listening in. Please don't print a bunch of applications and hold on to them. Programs change all the time. They close, new ones open. Sometimes their eligibility requirements change. It's best to get a fresh application off the website each time you apply or help a client apply. Now we're going to move on to another section of our website, which is the Services tab at the top. And I wanted to show you our Generic Assistance Program under that tab. NeedyMeds has funded a program called the Generic Assistance Program, or GAP. And the goal of this program is to help patients afford the cost of generic meds to get them completely free for up to a year. Now, as you can clearly see, we are not accepting applications at the moment. The GAP program was so wildly successful that we ran out of money much more quickly than expected. I'm pointing this out, however, because we are working diligently to replenish the fund and hope to be able to reactivate it in the near future. So please keep checking our website every few weeks to see if it's up and running again. Anyway, with this program, all you would have to do is scroll down to the 20 generic medications and their dosage that are covered under this program. And once we get the funding, each of the medications will offer a hyperlink to a prescription assistance program that will allow the person to get them for up to a year for free. To be eligible for the program, you must have no prescription coverage, be below the 200% federal poverty level, the calculation I showed you just a moment ago, and be a legal U.S. Please again, be sure to check back regularly to see if we have received funding for this program. Next, I would like to point out another program called our $4 generic discount drug program. And this will be under the Patient Savings tab, where we'll spend the next portion of our website. As you can see under prescription assistance, there's a hyperlink for the $4 generic discount drug program. This program is a database that offers low-cost medications, as opposed to the GAP program database we just reviewed, which offers no-cost medications. Now, this is a directory of all the discount programs for generic meds available at major retailers. Most range in price from $4 to $15 for a 30 or 90-day supply. As you can see as we scroll down, there are a number of ways to search for a drug, but I'm going to use the simple state search. So let's choose Oregon, for example. The results generate 16 discount drug programs in Oregon. And all of the pertinent information that you'll need is right on the screen in front of you, including the store name and a hyperlink if available, the name of the program, and importantly, what specifically the program can offer you. Now, moving on, under the patient savings portion of our website, one of the newest additions that we have on our website is the section for help with prescription assistance applications. Applications for PAPs can be complicated. So we built a directory that lists nonprofits that help people apply for PAPs. The places we have listed are usually free or will assist you for a very nominal fee. You can search for help in your area by zip code or state, and then programs are listed alphabetically by city. Let me show you really quickly how simple this is to search, and we'll do a state search to keep it consistent, and let's say we're looking for Texas. The results generate that there are 38 application assistance locations available in the state of Texas. And similar to the other database, you can see the program name is listed, who they're able to help, and a link if one is available to that program. As I said, we are developing this section. It is not by any stretch a comprehensive list. So please let us know if you're aware of a program that is not listed or if you would like a region in the country represented. Let's move on to other helpful sections of the NeedyMeds website. Again, returning to the Patient Savings tab, you'll see if you scroll to the bottom, we have a database for both free, low-cost sliding scale medical and dental clinics. About 14,000 clinics across the country are in this directory. And as I said, it includes both dental and medical clinics. It also includes women's health centers and even locations for STD testing. These clinics are a great option for those, let's say, with medical but not dental coverage, or vice versa, for those who find themselves without a primary care physician, and certainly a great alternative to an emergency room visit for those who may visit an ER, not because it is necessarily a medical emergency, but maybe because they feel they have no other option. As you can see, like the other databases, there are a couple of ways to search for such clinics, but to be consistent, we'll do a simple state search. And let's say, for example, in this instance, we'll look for something in the state of Alabama. At the top, you can see that there are 195 free, low-cost, or sliding scale clinics that have information in this database for the state of Alabama, including the clinic's name, contact information, and link to their website, the eligibility requirements, meaning who it is they treat at that clinic, and the details of the services that they provide. Now, here's a quick tip. You can certainly print all 195 of these clinics, or you can narrow down the search even further by scrolling to the list and clicking the clinics only that you are interested in. And then instead of printing all, you choose the print option. This will generate and print a list including only those you chose. That's a great tool for healthcare professionals that maybe want to provide their clients with a list, but one that's more specific to their needs. Another important cost-saving tool under the Patient Savings tab is our Coupons and Rebates database. This database is where you can find prescriptions and over-the-counter medications or supplies written as prescriptions for which there is a discount, a free sample, or even a rebate available. Just like our other databases, you can search a couple of different ways. And in this situation, just as an example, I'm going to choose category. And I'm going to choose diabetes, since that is a very common diagnosis in our country. You can see from the text at the very top of the screen that we currently have information on more than 1,500 coupons, rebates, and other cost-saving help for someone living with a diagnosis of diabetes. Hopefully, at this point in the webinar, you are starting to see, first of all, that the NeedyMeds website is easy to use. That's our goal. And we also want to, hoping that you see that a lot of the databases are set up similarly. Again, that's purposeful. We're trying to make it as concise and as straightforward as possible so you and your clients can find what you need within a few clicks of your mouse. Another great source of savings is through our diagnosis-based assistance. Again, returning to the patient savings portion of our website, please in the future, when you're looking for a diagnosis-based assistance, choose that hyperlink. Now, a diagnosis-based assistance, or DBA, is a program that provides financial assistance for costs associated with a particular disease. For the most part, this database is different because it excludes medications. What it does include instead are other necessary medical expenses, such as, let's say, travel expenses to a doctor or specialized facility, supplies, durable medical equipment, testings, wigs, even house cleaning services, copay cards, or assistive technology. Again, there are a number of ways to search by diagnosis by state or the less common program name. But just like the coupons and rebates, I'm going to search by diagnosis. And again, I'll pick a broad category and one that's common in our country, cancer. The results generate 154 DBA programs for people living with a diagnosis of all types of cancer. I would like to point out with this database that again is set up similarly to the other databases, meaning that you will find a link to the program name, a summary of what this program provides, details about the services provided, and what population in our country this program serves. I would like to point out here that at the top of the list, you will find programs that are national, meaning that they serve anyone within the United States. As you scroll down, the programs are listed alphabetically by state, and again, that refers to programs available for only residents of that particular state. Returning to the Patient Savings tab, another important resource I'd like to point out are our diagnosis information pages. Now, our goal with these informational pages is to partner with reputable organizations, either other nonprofits or governmentally funded organizations, to provide the most comprehensive information about a particular disease. So let's say your loved one has just been diagnosed with Crohn's disease and you don't know where to turn. Well, if you turn to the diagnosis information page on that disease on our website, you can see that we've partnered with the Crohn's and Colitis Foundation of America. And they will provide concise information about the diagnosis and about their foundation. They'll provide reputable links on the right-hand side. And a really important tool that we provide, which we're quite proud of and we believe differs our page from other informational pages available on the internet, is that at the end of each diagnosis information page, we provide a list of medications, and each of those medications are hyperlinked and will automatically search to see if there is a cost savings program available. Meaning, if there is a prescription assistance program available for CANASA, if there is a diagnosis-based assistance program available for Crohn's disease, if there is a coupon, if there is a rebate, you simply click on that hyperlink of that drug and we'll be able to our site will be able to tell you what cost savings program is available. Two other quick databases I want to take a moment simply to bring to your attention, and again under the patient savings portion of our website, is the CAMPS database and the scholarships database. Now they're basically set up similarly for the purpose of just showing you an example. I'm just going to open the CAMPS database, but again, this is set up similarly to scholarships. And the most important point I want to stress about these databases is to think broadly, not narrowly about them. What I mean is that the assistance provided in the camps and retreats database, as well as in the scholarships database, are often not only available to those personally affected with a particular diagnosis, but also for their children, siblings, parents, or other loved ones of the person that's diagnosed. Also, when we hear the word camp, we usually think something for children, something for summertime, but please note that the database is camps and retreats, meaning that there are many programs available for all ages that run all year. So just because, let's say, you work with a senior population, don't automatically dismiss these databases as something they would not be applicable to or interested in. It may be just another resource that you will find helpful. I also would like to point out our government programs section under the Patient Savings tab. The government programs, as you can see, include state-sponsored programs such as PACE sites, which, as you probably already know or have heard, are program of all-inclusive care for the elderly sites, which is a Medicare and Medicaid program that helps people meet their healthcare needs and focuses on keeping people in their homes as opposed to nursing homes. We also have a helpful link for Medicare information, as well as Medicaid sites. At NeedyMeds, we're very proud of our relationship with our local and national SHIP counselors, which hopefully you're aware are federally funded health advisory programs to help people with their insurance coverage through Medicare. And finally, you will also see a link to the federal poverty guidelines and even a tax request return form. Now, since a lot of applications through the government and a lot of their questionnaires require income and tax details, we included these helpful links so they would be right at your fingertips. Something else I'd like to bring to your attention, on the left-hand side of your screen, you'll see a box for HealFundr. Now, HealFundr is different because it's not a database. HealFundr is actually a crowdfunding platform. Maybe you've heard of or have even used other crowdfunding platforms like Kickstarter or Indiegogo. Well, HealFundr is based on that similar premise, except HealFundr is a crowdfunding platform used specifically to raise money for medical bills. And those can be medical bills that have already been incurred or something a patient is saving up for. And organizations can certainly use this platform for their fundraisers as well. And we'd be happy to help organizations that do use HealFundr to promote it on our social media. If that's something you're interested in or your organization is interested in, you can certainly contact me at the end of the webinar. Our crowdfunding platform, however, is different and distinguishes itself by two unique properties. The first thing is we always verify the diagnosis for which the funds are being raised, meaning that we do require documentation from the treating physician. And it also distinguishes itself because we pay the medical bills directly, so you can be assured that the money that you're pledging or raising will certainly be allocated towards where it's promised. So we can go over, and another really important way you can save money through NeedyMeds is which is through our NeedyMeds drug discount card. With the NeedyMeds drug discount card, users can save between 0 and 80% off the cash price of prescriptions, over-the-counter medications or supplies written as prescriptions, and even pet prescriptions if you pick them up at the People Pharmacy. Please do keep in mind that not every product will be discounted, and our drug discount card only works for brick and mortar pharmacies, meaning it cannot be used online. Last month, our card saved consumers nearly $4 million, and we're happy also to let you know that the card is used 85% of the time that it is presented to the pharmacist. So how does a drug discount card work? Pharmacies negotiate discounted prices with an adjudicator. Discounts change frequently. They vary from month to month and from pharmacy to pharmacy. So we suggest that you try the card each time you make a purchase. There are no eligibility requirements, no registration, no activation, no application. Now, I'm sure you're aware that there are many drug discount cards out there. So what's different about the NeedyMeds card? First, as I said, it's free to obtain and use. Secondly, we do not collect any identifiable information about users. It remains totally anonymous, so you can be assured that we won't use your information for marketing purposes to a third party. We simply track the dollar amount of the savings and the number of times the card is used. And thirdly, although we do earn a small transaction fee each time the card is used, we don't try to maximize our own profit. Our card never expires. It can be shared with your family members and friends. You simply bring your card and your valid prescription to the pharmacy. It is accepted at over 63,000 pharmacies nationally, including all of the major and local chains. If you ever have trouble using the card, or if a pharmacist gives you a hard time, you simply call the toll-free number on the back of the card. Who can use the card? Anyone, literally anyone. The card is meant to fill a gap where someone might not be eligible for a prescription assistance program, or we couldn't help you find a coupon or rebate or diagnosis-based assistance program, or let's say someone is lacking citizenship status, or they do have insurance coverage or their income level is too high. Anyone can use this card. Keep in mind that the only rule is that it cannot be combined with insurance. So, if you have insurance coverage for medication, you cannot combine this card with that insurance. But if you are uninsured, you can use the card anytime. Now, you may be saying to yourself, why would I use a NeedyMeds drug discount card if I already have insurance? Well, first of all, you may not have medication coverage on your insurance. You may also find that your copayment or deductible is too high. You may find yourself in a coverage gap like the Medicare Part D donut hole, or you may have even exceeded a cap for drug coverage for the year. Now, right on your screen, you can see that there are 3 simple ways to get a drug discount card. You can print it out from our website, which I'll show you in just a moment. You can send us a self-addressed stamped envelope to our P.O. box, or you can send us an email to my colleague Alana, who will be happy to fulfill your request. Now, I'm going to take a moment to return to our live website to show you not only how you can easily obtain a drug disc card for yourself, your families, friends, and coworkers, but also how to access these handy tools that you see on your screen at the moment so that you can maximize the savings. Now, on the NeedyMeds website, you can simply click on the link on the left that says Get Your NeedyMeds Drug Discount Card Today. Under the Patient Savings tab, you will also find a link in more than one place, actually, where you can click to get your NeedyMeds Drug Discount Card. And once you click on that, you can see what I was referring to. You can print out a downloadable PDF right here. You can fill out the form below, making sure you choose a design, and we'll make sure we'll get it to you. Or, again, you can mail us a self-addressed stamped envelope to our P.O. box. If you keep scrolling down, a couple of the handy tools that you just saw briefly on the PowerPoint presentation are at the bottom of this page. One of the tools is the pharmacy search. The great thing about this is you can simply type in the zip code of where you live, and for our webinar, I'll just demonstrate where NeedyMeds is located. And what this will do, it'll automatically generate a list of pharmacies, as well as their contact information and location, that we already know are willing to accept the drug discount card. And that's very helpful to know where you're headed before you venture out. Another helpful tool on the top left-hand side is the drug pricing calculator. The drug pricing calculator will provide you with estimated prices for a particular drug for that day. Now, keep in mind, it is quite simple to use, but please do keep in mind, and this is what you have to fill in on the left-hand side, is simply the drug, the pharmacies that you'd like to be able to pick it up at, the quantity, and the day's supply. But I do want to stress, as I said, this will provide you with an estimate for that day, meaning although it will be a close estimate, it will not be accurate down to the penny. And as I mentioned earlier in the webinar, prices do vary from day to day. So you're going to want to check the drug pricing calculator right before you head to your pharmacist. Returning to the NeedyMeds homepage again, we also offer helpful apps, including a medication reminder, as well as a NeedyMeds drug discount card app. And while we're still on the website, I do want to spend a few brief moments under the Advocates tab. The Advocates tab is a way for healthcare workers or people interested in becoming their own healthcare advocate or their family's healthcare advocate. This is ways you can stay up to date on topics that may be of interest to you, as well as resources that NeedyMeds we hope you will find helpful. I always suggest that people sign up for a Patient Assistance Newsletter, or PAN. This is a great way to keep abreast of resources and articles related to patient advocacy, as well as updates that are happening at NeedyMeds. We send it out every other month, and we certainly recommend that as a tool to stay updated on what we've been up to. Another couple of update tools we suggest are our PAPIS or DAPIS email alerts. Now they're similar, except obviously one is an update email alert for patient assistance programs, and the other is an update email alert for diagnosis-based assistance programs. And what that means is whenever the researchers on the NeedyMeds team make an update to PAPs or DBAs, meaning that something changes on the already existing ones, maybe we've removed a program, maybe we've added some, that you will be kept up to date on either a daily or weekly basis, whatever you find most helpful. And in addition to the webinar that you're listening in on today, another great tool to become familiar with our website and how to navigate it and the tools that we provide is our Patient Assistance Resource Education. And through PAIR, which offers a course and exams, you will be able to take a self-paced online tutorial to find out more about how to find assistance for your patients through the website. This is a great professional development tool for which we normally charge $15 for that course and exam, but certainly if that is a financial hardship for you or your team, please let me know. We'd be happy to discuss reducing or waiving that fee. It really is a great tool. For those listening in that are healthcare professionals and find themselves handwriting prescription assistance programs regularly, you may want to consider PAP Tracker software. This is a software that eliminates handwritten applications and manual tracking of the orders. We also offer a bunch of partnership opportunities. We're willing, of course, to co-host special topic webinars, meaning that if your organization would like to partner with me doing a webinar in the future about a particular diagnosis or educational tool or resource for saving costs on your medication, just let me know. We're also happy to customize drug discount cards for organizations and businesses. We'd love to partner with nonprofit or governmental organizations to create, which should say there instead of disease diagnosis informational pages. And of course, we're happy to cross-post with each other's resources on our website and our social media pages. We're hoping that you are passionate like we are about helping people to save on their growing healthcare expenses. So if you'd like to spread the word about NeedyMeds and help people in your community, please send us an email to outreach@needymeds.org to become a NeedyMeds volunteer ambassador. As I promised, there is my contact information. You can email me with any questions. And I also included the email address for my colleague Alana, who is actually our fulfillment coordinator and office manager. She would be happy to provide you with any printed materials or drug discount cards. Now I'd like to take a few moments to open the floor for conversations, for questions if you have any. I think I had a question regarding pharmacists who will take the NeedyMeds discount card. We do have a list of pharmacies on our website in a pharmacy finder, and I'll show that to you right now. That will come up. If you click on the NeedyMeds drug discount card option, wherever you find it on our website, and you scroll all the way to the bottom of the page, that is the pharmacy search. And you can type in the zip code and the number of miles you're able to search within, you're able to get to within that zip code, and it will provide you with a list of pharmacists already in your area that we guarantee already accept the NeedyMeds drug discount card. Someone asked when we will have this webinar again. Please check out the webinar section of our website, which I'll point out to you right now. Under the Advocates tab, you can see NeedyMeds webinars. The monthly webinars you usually try and schedule towards the end of each month, and the upcoming ones are, let's see. The next one is June 23rd, and the one after that is July 23rd. But check back regularly. Although we do the overview monthly webinars once a month, we try to populate our calendar also with special topics webinars. Okay, we also have a question. Someone looking for some more information on checking the price of drugs. So again, if you return to the home page on the left-hand side, you will see an interactive box titled the Drug Pricing Calculator. This will actually take you to a page that tells you a little bit more about the drug pricing calculator, give you a disclaimer, and then you'll have to click on that hyperlink and be redirected to an external website. What you're looking at now on your screen is the drug pricing calculator. And you follow the steps clearly labeled, or we hope you feel are clearly labeled on the left-hand side of the screen. And to find a drug price, you choose a drug by clicking on that hyperlink. The next step is to choose a pharmacy in your area where you're able to pick up that drug. And you will also need to know the quantity and the day's supply. Again, I would like to stress that this drug pricing calculator will only provide an estimate for the drug cost. Although it is a very close estimate, it is not accurate down to the penny. And because drugs prices change from day to day, we suggest you check the price for that day before heading to your local pharmacy. So we have someone that's looking for dental assistance and possibly dental assistance programs specifically for seniors. So I'm going to bring you to return to the live website. And if you return to the Patient Savings tab, you will see on the left-hand side under the free and low cost or sliding scales clinic box, there is an entire section for dental clinics. We currently have more than 3,200 dental clinics in this database. I'm unable to tell you the extent of what those clinics will provide, but you can certainly pull up ones in your area, let's say according to the state you live in. So I'll pull up Massachusetts. And as you can see, in Massachusetts, there are 72 free or low-cost dental clinics. This will give you more information about those clinics, including the location and whether or not it's convenient for you to get there, and their contact information if you have questions, the eligibility, indicating who can actually be treated, and the details, meaning what they'll provide. I will take a moment to say, if you don't find what you're looking for in these databases, or you're having difficulty locating the information you'd like, I always stress to people to please reach out to our expert counselors on a toll-free number that is indicated right at the top of the website. It's 1-800-503-6897. Our counselors are there Monday through Friday, 9 a.m. to 5 p.m. Eastern Standard Time, to make finding cost savings healthcare options as easy for you as possible. So someone also asked whether or not they can find the cost of a drug using the discount card, or you just need to present it to the card at the participating pharmacy. As I reviewed just a moment ago, you can certainly find out the price of that drug through our drug pricing calculator on the left-hand side of your screen. I do have someone that's asking for help potentially with finding some financial assistance for securing hearing aids. I have two recommendations for that specifically. You would want to look under the Patient Savings tab under Diagnosis-Based Assistance, and you'd look for the diagnosis as to why the hearing aid was needed. Because Diagnosis-Based Assistance is the database where we would look to find cost-saving programs for your needs outside of actual medication. And again, I say if you don't have any luck there, pick up the phone and call the counselors on our 1-800 number. I also want to extend a big thank you to people that are sending me specific questions about certain drugs. I would say if you're looking for medications, to type in the drug search field on the left-hand side, or start under the Patient Savings tab under Prescription Assistance by either brand or generic name. If you're looking for assistance not necessarily for a medication, but let's say for a hearing aid or other assistive technology, that's when you're going to want to check our Diagnosis-Based Assistance database. And again, if you're not having any luck or have some questions, our counselors are available to help you. It looks like that are all the questions I received for today. But please, if you think of something when the webinar is over, feel free to email me directly at your convenience, and I will show you once again my contact information. Again, my name is Carla, and I can be reached at carla@needymeds.org. Or if you have questions looking for specific assistance, please call our toll-free helpline. Again, that's indicated at the bottom of the PowerPoint screen right now. Thank you so much for taking the time this afternoon to join NeedyMeds and learn about, hopefully, ways that we can help you. We do look forward to your keeping in touch. And thanks again for your time. Take care.